Namaste everyone. I hope wherever you're in this world, you're keeping your calm and spreading the calm all around. Remember, calm is contagious and we have to spread it more. So today I'm going to talk about my experiences with people and patients who come to me for knee arthritis. I normally use these two techniques which I find very helpful in all the people who have knee issues, especially knee arthritis. It is also helpful if you have any torn meniscus. It can be lateral meniscus or medial meniscus, or you have ACL injury. It will be also helpful in those as well. But I have a huge experience for people with knee arthritis and I find them very helpful in those patients. So I'll show you my setup and then we'll go for it. There are two movements mainly I'm going to do in this video. There are a couple of other things I do, but to make the video short, I will just give idea about these two movements, and they're the most helpful I find. The first one is basically to both of them. What they do is basically the goal is to decompress the knee joint. In the joint capsule, if there are the tissues or connected tissues are compressing against each other, there too much pressure within the capsule, then it increases the pain and inflammation. But if you can decompress the joint capsule, or give the traction means you're pulling them out, so creating more space in this socket. Once there is more space, then those connective tissues get enough space to heal because they all require space. So that's the principle we follow in this video. So once there is road space, more circulation, so tissues can be tonified and nourished easily, and they get healthy. So first setup is this one. You need some kind of hanging thing. If you see, to show you completely, if you see this, can you see this on the top? Yeah, so I hang this thing using a few rubber bands. Yeah, you can find any kind of structure, or you can make one. I think it's very easy to make if you have some skills in the do it yourself. Okay, here is the complete setup. You need some sort of bolster to lie down, and kind of bench, and this hanging structure which I already mentioned, and two rubber bands, and the rubber bands are basically anchoring this wooden structure on some support. Yes, so can you see this is coming down? These are two basically rubber bands. Yeah, so these will basically help in the traction of the joint because they will pull it up, and the weight of the legs due to gravity pull it down. So that opposite pull from both sides will help in that traction I was talking about in decompressing the joint. Okay, so let's get into the pose. The pose is Setu Bandhasan. Here is the demonstration. So you lie down on this bolster, grab these handles, pull it down, place one calf and the other calf on these handles, and if you see this structure is pulling me up because of these rubber bands, and the weight of my body pulling me down. Yep. And then what I do is I place my feet on this bench, yeah, and then push the hips up. Can you see this position? And then raise the toes up. Inhale and exhale. So I'm raising the toes up towards the shin bone and then down. It's a good idea to rotate them slightly internally, toes out and then pull them up. So toes out and pull them up. Inhale and exhale. So my toes are constantly moving up and down. My hips, I'm pushing it up, and my heels down on the floor, and this thingy is pulling me up. So it's a good way to decompress the knee joint. It will give a nice traction to the knee joint. It's a homemade solution rather than spending thousands of dollars on some machine to give traction to the knee joint. So this is a good way. And then if you want additional challenge, what you can do is you inhale up and try to move to the opposite side to give some rotation to the knee joint. to this core, and that will help in giving some sort of rotation to the knee joint as well. So can you see I'm raising my left arm, going to the right side, and then of course I'm doing it other side too. Yeah, so in this one I'm moving the hips up and down as well. So this is the second stage you can do. Inhale and exhale. And then once you get tired in between, you can do again come up in this position. So hold at least 2 minutes. You can do up to 5 minutes. I made my patient hold for up to 5 minutes in this position. Start, of course, not first day. Start with 1 minute and then 2 minutes. So you can do it easily up to 5 minutes. They will really get a strong posterior kinetic chain as well. Plus good for the knees. Any arthritic patients. And see my toes going out and up. Yeah. So this was the first setup. So when you come out of it, remember, don't just pull the knees away because it can shoot up and it can fall back on you. So grab this because this is pulling really hard, these rubber bands. Use your hands, pull it up, let it go softly, and then come up very gently. You can actually roll to one side and then come up. So that was my first setup. I have to show you another setup, setup number 2. Now for the second setup, what you need is you need something, a flat board. This is wooden board, slightly, I mean it's attached to the wall, slightly at an angle. So it gives you that slant height. And I'm going to use this this thing. So the beauty of this thing is you can get it easily here in Australia. So it's a kind of roller. They call it ab roller. So you can fit actually your feet in it. Can you see this? So this will to mobilize the knee joint. It's very good for people who have torn meniscus, or there is a particular condition which is known as what do you call it? Sorry, it's not bottle. It's a bucket handle tear. It happens in the meniscus. So it's a kind of bucket handle tear. So in this problem, they can't extend the knee fully. So this is a good way to introduce the full knee extension, because you're doing this knee extension without any body weight. And once you give the motion to the knee joint, the motion is like a lotion, and then it starts healing, and then you can slowly introduce more weight to the knee joint. So if you see, I'm going up and down. So I'm giving full range of motion to the knee joint. I find it very helpful with arthritic patient, with the patient also who are bone on bone, that condition. And next day they called me up and they say that they never feel so good. So it's such a magical moment. So you're going down and coming up. So this is full extension of the knee, can you see? And this is full flexion of the knee. Full extension, full flexion. So all I'm doing is this. So now if you do full range of, you can't even think of giving the full range of motion to the knee patients. They can't. But here they can, because there is no weight on it. And this wheel is also helping to take the weight off. So it can freely move up and down. So this will bring more the body fluids and the blood to the connective tissues and help them healing faster. So I would advise that do it I normally do with about 5 minutes at a time, and then give some rest for 2 minutes and then 5 minutes again. So that's my regime normally I follow. And the next day they feel so good. So with this movement, what happened is, once you have some issues like knee arthritis, so there is a lot of toxins which basically get stagnated, that accumulated in that area. So once you start moving the knee joint, then of course that things start moving and it start clearing up all those toxins and you feel good. So yeah, Excellent. So this is my second demonstration. So they were basically to do in my protocol. I follow these two must do exercise for people, for patient with knee arthritis. I hope you find this video helpful. If you did, please like, subscribe, and share the love and share the peace. Remember, peace is contagious. We have to spread it more. See you soon with the next video.